Welcome, Javeria.
Assalamualaikum. Thanks
Thank
for
you so
having
much.
me.
Lovely to see you. How are you feeling today?
Good, Alhamdulillah. How are you?
Doing well, thank you. Do you want to introduce yourself to the folks who are just getting to know you?
I'm Javeria Arshid. I'm a former psychotherapist, now turned transformational coach and hypnotherapist. And I primarily do inner child work and work with women who have experienced trauma and just need more support, letting go of emotions and that cycle of up and down that keeps happening.
Excellent, thank you. And you've been a long time. You've been in the honored womb universe for many years. We met through a workshop many years ago. So it's really great to
Yes.
still be in contact with you and to see how your womb journey is progressing alongside your professional journey. So thank you so much for sharing. So we'll start with just how do you define trauma? How do you define trauma and how do you recognize it?
Yeah, so I have a very simple definition that I use, which is that trauma is any kind of deeply distressing event or situation that occurred, and it still has an impact on you now, whether that's something you're aware of consciously or subconsciously. And then I see it as it shows up in so many different ways in our lives and in our health, in our relationships.
Awesome. So just this kind of lingering impact of something in the past that's really deeply distressing. So in
Yeah.
our womb, we've had sessions on womb trauma release and just understanding trauma. And so, can you just help people make the connection? What are some of the ways that experiencing childhood trauma impacts your womb health, even in the present?
Yeah. So essentially, when we experience any kind of trauma, especially childhood trauma, being so young, our brain had to adapt for safety. And in doing that, we often have to abandon our body connection so we can feel safe in that traumatic situation. Sometimes it's one event or it keeps reoccurring. So when we have to do that, there becomes this disconnect between within our body. And I think that's where that we carry that sense of like maybe hypervigilance and that kind of chronic stress in the body. And I believe that's where it impacts our health and our womb health because of that disconnect. And then it can show up in different ways as well because now we have the words and language to know that trauma does get stored in our body, specifically in the fascia, which is like this connective tissue all throughout our body. And trauma does get stored in there due to those like that fight and flight mechanism that happened. Our body was trying to protect us, and that's actually a protective response. Um, but it tightens that fascia in like physically in our body because it's trying to protect like all the organs and everything else, the muscles and everything. But then it kind of stays in that way. So that can result in like tightness and pain in different parts, like, the hips and different joints and muscles, and where you can see people experiencing like chronic pain that shows up in the same kind of areas.
Okay. Yeah, it makes me think of when I started learning about endometriosis and came to discover that there's a high correlation with different forms of the domestic abuse, childhood abuse, and its connection to endometriosis. And that makes so much sense because you're talking about this tightening, and they called it armoring even, that this
Hmm.
tissue that becomes very difficult to shift and very constrictive and constraining, is like almost a way that the body armored itself
Yes.
to protect from some kind of threat, that the
Mm-hmm.
body felt, that the individual felt consciously or subconsciously. And so if you imagine that you have this constant bracing and armoring of of yourself, then you have these situations where the tightness is creating pain, it's constricting blood flow, which very practically contributes to painful periods, right? If blood flow is not optimal, if there's this constant tension and tightening in the pelvic space, then even sometimes the uterus is not optimally positioned as a result, or there isn't really great movement of flow of circulation. And that just is really, in Eastern medicine, we call it stagnation. And it's such a foundation for so many other issues, because when blood flow is stagnant, when there's constriction and tension, then we tend to have a lot of clotting, a lot of cramping, have growths, adhesions, the kind of basic fundamental of adenomyosis and endometriosis is this tissue that's growing where it doesn't belong. So thank you for kind of helping us understand that connection, because we hear about it a lot, womb trauma, 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 but sometimes people don't understand the actual mechanism by which it's impacting your health right now. And then particularly with sexual trauma, that's also another obvious space where the body could be tightening, clamping up, not able to receive any kind of penetration, or even soften into intimacy, which is a big factor as well. And I know that even with vaginismus, there's a huge connection there. Even if someone wasn't personally assaulted, sometimes there's like a psychological trauma around bringing. And so, can you speak a little bit to how maybe some people have experienced, even if it wasn't a direct assault type of trauma, how can ideas about our bodies and sexuality be a form of trauma that impacts us in our sexual health?
Yes, yeah. So there's definitely that like emotional kind of mental impact of things as well. Like it doesn't have to be like you're saying what we might call in the trauma world like big T trauma. It can be little T trauma, like maybe there was shaming around your body and things like that, or you might have heard stories about pregnancy or loss and things like that, maybe at a young age, and they kind of you started having some fears around that, and we store all those things in our subconscious, so we're not always aware that those memories and experiences are kind of operating our worldview currently. But it's kind of little things that might still be there. So that might translate into like maybe feeling like, is something wrong with me? Am I ready for, to have kids and go on that journey? Is that something I deserve? And there might be other things that show up like a deep need for control. Um, and I think that's also related to that like disconnect with the body. Um, because then we want to control things like outside of us as much as we can and in us, but it's really hard to control your body because, it's something that more so we need to like observe and be with and kind of witness.
Yeah. And I think, even if you've heard, even if I think on the other side, ignorance can also be another factor too, and that's its own trauma when you don't know what to expect when it comes to marriage and intimacy. So I've heard of some women who were just afraid that first time sex was going to be painful, and or there in some cultures there's this idea of looking for blood on the sheets after first time
Mhm.
intercourse to confirm virginity, and all of these really weird contortions and you know um really weird ways of expressing values, in different cultures. And so you have women who literally are just afraid, like, again, they don't have a lot of experience being present with their bodies, or they're told for so long that, oh, sexuality, sex is something like, no, 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 don't do it, don't do it. And then you get married and there's been no guidance, no instructions, no support in navigating questions that are really just an essential part of who we are. So how have you seen this also impact conception journeys, pregnancy, motherhood? How have you seen this kind of lingering trauma impact the journey that women experience when trying to conceive?
Yeah, I think the overarching thing is like around safety, and that's what I was thinking about as you were talking about, someone newly married and like how they might feel as well. It's like if you don't feel safe in your body, you can't feel that safety with your spouse. And it's kind of like a multi-layered thing, because that work we have to do on ourselves to create that safety in our body. But then there's the piece of like with your husband, like um, all those like relationship dynamics which come up as well. Um, so I think that's the part of I see where um when you don't feel safe in your body and you're not able to connect with it, then it brings up like just challenges in kind of different areas with like with fertility and in pregnancy and even like with like breastfeeding and in postpartum, because I feel like so many, if that kind of journey requires us to trust our body and like the mechanisms that we know it has and like that are divinely created and can operate like beautifully. um but when we don't like there, and that's not just like blame on the person, there's obviously how the trauma it impacts those things in our body. But then there's also the piece that like when we are in chronic stress, that also affects all of those things.
Yeah, yeah, for sure. And I feel like I've seen women on fertility journeys, and I'm just surprised by how much they just normalize and tolerate painful intercourse. It's just kind of like, well, that's just the way that it is. Or they have a very confusing relationship with pleasure, whereas they probably were told that sexual pleasure was not appropriate for them or not for them as women. It's just something that men want or need. So I've been surprised by how many women are willing to endure their disinterest in sex or their difficulty with sex just to get the baby. And it's like, okay, let's sit back a little bit and look at this contextually. What needs to be unpacked so that your process of conception is not you bracing and just kind of bearing an experience to get the thing that you want, this kind of no pain no gain mentality. What would it be like? What imprint would it have on you, your relationship, and your baby, for instead your conception journey to be one of safety, love,
Mhm.
connection, pleasure, enjoyment? Because that's an imprint that still lingers and stays in our cells and in our being. And so I always try to have women imagine that instead of just looking at intercourse as a transaction to get the thing that you want or please the person that you think you're supposed to please, what would it look like for it to be an expression of connection, of safety, of joy, and and really addressing what's keeping you from accessing that before just trying to calculate and treat it as like a very mathematical computation. Like sometimes women are so in their head about their fertility journeys, but I do believe that the journey of mothering and birthing, pregnancy, is an invitation to be so in your body, like so very present with your body, to know and read the cues, the sensations, how you're feeling, and to express what you really need, at your most basic fundamental level. And so, yes, like dissociating from your body in sex and in pregnancy and in birth doesn't really bring the best outcomes in that journey. And so having healthier experiences across the board, it is valuable. So what kind of tools and resources do you offer for women who have had an experience of past trauma or feel like there's something kind of holding them back from fully feeling safe in their bodies and in this particular moment in their lives?
Yeah. So I'll go over a few kind of practical things that they can try, but primarily what I do is hypnotherapy, a type called rapid transformational therapy. So we really get to the root of whatever it is that they're feeling is like keeping them stuck. Sometimes it's like they know that there were these significant events and that's what they want to work on, but sometimes it's more just whatever emotions are coming up now, or it's that goal of like, I would like to get ready for conception in this time, and I have some like resistance around it. So we just work through that and work through clearing whatever comes up in the body and in the mind. Um, so that's what we do. And then like the other things that I would invite someone on this journey, wherever they're at, um, is to just do practices that help them to connect with their body more, and on releasing like whatever emotions that are coming up, because all those like emotions are still stored in our body. And sometimes we might, notice something, but because we have to go on with our life and our obligations, we just kind of push everything down so we can continue with the um, roles of motherhood. So I just invite them to allow those emotions to come up, and whether they release this through like journaling or like even crying, communicating and sharing with a support person, whether that's a friend or another more formal support like a therapist or a coach. And then movement is really great. I know you talk about that as well with like womb care and all that. Um, Movement is also part of like the stress completion cycle. And we like see those images and hear about like how animals like shake and move after they've experienced like a high stressful situation. So think of it in the similar way. Um, and where we need to kind of like shake out all those um, stressful hormones and things like that and let go. And that can look like something simple as going for a walk or putting on your favorite song and dancing, doing some yoga or a workout, whatever it is that feels like easy to you. And that can help a lot to just process those emotions and things that are coming up in the body. Um, and then, like I was saying, I do that inner child work where we like really get into that. But if someone wanted to do it on their own, I have a book recommendation as well. I don't have it with me because I took it somewhere to show, and then I didn't bring it back to my office. But it's called Recovery of Your Inner Child. It's a purple cover, and that's based on like art therapy. And it has really simple exercises that you can do to just get in touch with your body and your feelings and whatever might be coming up.
Yeah. That's great. When you mention also gentle practices, I find that, womb steaming is really one of those practices that gives women an opportunity to be present with their bodies without expectation, the opportunity to to be aware of sensation they're feeling in their pelvis, in their vulva, but there's no expectation. It's not a sexual stimulation, it's just sensation. What does the warmth feel like? And how do I feel the warmth impacting my body? And even in cases when we use steaming to support women who've experienced sexual assault or just have struggle with vaginismus, where there's just this opportunity to just allow your body to kind of soften and open in its own timing. And that's something that we talk a lot about in the Honored Room Circle membership as well. Yes, this will be saved, inshallah. So, it's something that we talk about as well. We have different movement practices within our membership community as well, because like you said, just being able to move your body. I know one sister was saying she was given some exercises to do, and just being in certain positions with her pelvis open, like hip flexor opening positions, with her knees open, and that alone brought up so much emotion, because there's been so much like keep your legs closed, and
Mhm.
kind of keep yourself contained. And so being able to, I think she said she was laying on the floor with her knees spread out. And that alone just brought up this emotion. And so being attentive to how particularly movements, pelvic movements, especially, can help release, some stored emotions, and stored experiences in those tight places. And I always feel like, the pelvic floor in general is such a register of our safety. There's a lot of tension when we don't feel safe, but when we can kind of soften and open up and feel a sense of belonging, then we have that tenderness. I know that we didn't talk about this question, but if you want to share, if is there anything you'd like to share about your own womb journey since we first encountered each other many years ago? If you want to share about your cycles or anything that's been
Yes.
a fruit of your kind of womb presence, womb healing
Yes.
journey.
I would love to. We did talk a little bit about it. Um, so I think just since I encountered your work, I can't even remember the year. Maybe it was 2021. It's been a few years. I've had like a huge shift just in my own um journey with my period, especially because that's where I can see like things that are easy to notice and keep track of. And just by following like the different suggestions that you give in the book, um, and being more aware of my the different phases of my cycle has been so helpful. Um, and the biggest thing has been like just having a more positive relationship with my period and with my womb, and like kind of letting go so many of these like ideas and beliefs about what was like taught to me as being like normal, of having to be in pain and discomfort, and just because it was so common now I realize doesn't mean that it was normal. So through Chantal's guidance, in like all the various resources she has, in the book, and through the Honored Womb Circle, I've been able to make like practical changes that have really like shown up in how now like my period is, it's just something that happens. There's no like, it's not this negative thing and like all that like kind of negative ideas about it. And it's easy. Like I've had completely pain-free periods, a 28-day cycle, which I never experienced until I was 36 years old. And I just thought that it was not something that I would ever experience. And this is like I would always have 30 plus days, um, and like no cramps, all those things. So many changes in that. Um, and just I've been on my own journey of like loving my womb and seeing it as a gift from God. And all the like, and now I call my children the gifts of my womb
Hmm.
because that's what they are, and it's just kind of reframed so many ideas for me, and it's been really wonderful.
Oh, amazing. Thank you for sharing that. And I know you had your book on your table last time we spoke. Like, yes, I have your book.
Yeah, it's behind over there.
Aw,
So
thank
I
you so much.
reference it often.
Oh, alhamdulillah. I'm glad you found benefit in, the Peaceful Periods book, the Honored Womb Circle, and just, bringing that awareness to your menstrual cycle. So proud of you. Anything you would
Thank
like to share
you.
about your services and how people can work with you? We did talk about hopefully having you do a workshop in the Honored Womb Circle next year. So that's something that people
Yes.
can keep an eye out for, especially if you're in our membership community. But at the moment, do you have any upcoming programs that you'd like to share?
Yeah, so I have a workshop coming up on January 24th. So that's going to be all about goal setting and manifesting. And I'm really excited about that. I'll be sharing the process that I use to set my goals and what I do. I have a specific method of creating like a subconscious blueprint, you can say. So it's kind of like a vision board, but for your subconscious. So I'll be walking you through, and you'll walk away with your own blueprint at the end of the workshop. And then I have all the links in my bio to sign up for that. And then if anyone wanted to kind of explore more about working one-on-one, I also do free discovery calls to discuss that. And then the link is in my bio for that also.
Amazing. Thank you for sharing that. And as I mentioned, the Honored Womb Circle this month, we actually have a promotion where it's 50% off. And inside of our membership community, we have a live chat. We meet once a month for live classes, guest taught workshops, expert led workshops, as well as group coaching, and a new feature called Womb Studio, where we actually get to practice a womb care practice together. So there's actually more of a hands-on component. We'll be learning how to make herbal iron syrup with Sister Sabrina of Umul
Oh, nice.
Postpartum Apothecary. We'll be learning how to apply castor oil packs and having a virtual steam circle and just a space where people can practice actual skills instead of just reading about it, but having an opportunity to do that together. So until the end of the month, you can join the Honored Womb Circle. You can DM me Womb Keeper for more details and the link to join. And thank you so much for your time and contributing and participating in this conversation with us. And thank you all who attended. And you can follow Inner Child Mentor to learn more about Javeria's work and Honored Womb to keep updated what's happening in the Honored Wombniverse. So thank you for your time and looking forward to seeing you again soon, inshallah.
Yeah, thank you so much for having me. It was great.
Alhamdulillah. All right, you take care. Assalamu
You
alaikum.
too. Walaikum salam.